A very good evening to one and all who have tuned in today. My name is Ruta Mahamuni, and today we'll be learning about glands. So let's start. Yes. So, glands, unveiling the secretory masters. So, gland is a group of cell body that synthesizes substances like hormones, sweat, saliva, and mucus. They originate from secretory epithelial cells and store secretions in vesicles called secretory granules. Their activity is regulated by hormones or nerves, playing a crucial role in bodily functions and homeostasis. Now, let's see what are exocrine glands and endocrine glands. Exocrine glands are those glands that secrete their products through ducts onto an external or internal surface, such as the skin or the gastrointestinal tract. The endocrine glands are those glands which are ductless and they release hormones directly into the bloodstream, regulating various bodily functions. Now, this is a really nice chart which depicts the classification of glands. So, the glands are classified into endocrine and exocrine. Exocrine is further divided into unicellular and multicellulars. Then the multicellular glands are further divided into on the basis of number of ducts that drain the gland, that is simple and compound, on the basis of shape of the secretory unit, which is tubular, acinar, and alveolar, on the basis of nature of secretory product, which is serous, mucus, and mixed, and on the basis of secretory mechanism, that is merocrine, apocrine, and holocrine. Now let's see what are salivary glands. So salivary glands are compound tubulo-acinar merocrine exocrine glands, the duct of which opens into the oral cavity. So now let's see what this line describes. It describes the structural and functional characteristics of salivary glands. They are a compound, that means they have a branched duct system. They are tubulo-acinar, that means they have both tubular and acinar, that is sac-like secretory units. They are merocrine, that means they secrete without losing cellular material, releasing substances via exocytosis. They are exocrine, that we already know that they have ducts that transport secretions to a specific locations. The duct opens directly into the oral cavity. Their secretions, primary saliva, are delivered directly into the mouth through ducts. Now, the salivary glands are further divided into major and minor salivary glands. The major salivary glands constitute of parotid gland, submandibular gland, and sublingual gland, while the minor salivary gland constitute of labial and buccal glands, palatine glands, lingual glands, and von Ebner glands. So now let's study this amazing table which shows the difference between major and minor salivary glands. In this table, we will just highlight the important points like the size of the major salivary gland is larger than the minor salivary gland. Major salivary glands are three in number, while minor salivary glands are around 600 to 1000 in the oral cavity as well as in the oropharynx. The major salivary gland contributes around 90 to 95% to the whole saliva, while minor salivary gland contributes to around 5 to 10%. Salivary glands, the major salivary glands have single main excretory duct, while the minor salivary glands have multiple excretory ducts. The secretion of major salivary glands is mostly mixed except parotid, which is purely serous, while the minor salivary gland is mixed except for the von Ebner gland. Now talking about the secretion content, the major salivary gland secretion is rich in enzymes, mucus, and proteins, while the secretion of minor salivary gland is rich in proteins and which has an important role in innate immunity. Now let's study major salivary glands in more detail. Let's dive into parotid gland. So parotid gland is the largest salivary gland. It is pyramid shaped. It is 25 grams in weight. Talking about the location, it is located below external acoustic meatus. between mandible and sternocleidomastoid muscle, as you can see in the diagram. It extends from the zygomatic arch to the mandible angle. Talking about the duct of the parotid gland, it is called as the Stenson's duct, which is 5 centimeter long and 5 millimeter in diameter, and it is thick walled. The gland has four surfaces, as you can see in the diagram below: the superficial, superior, anteromedial, and posterior-medial, and three borders, which is the anterior border, the posterior border, and the medial border. Now let's see the structures that pass through the parotid gland. So the parotid gland contains several important structures. The facial nerve, which passes through, dividing it into superficial and deep parts, while giving motor branches to facial muscles. The external carotid artery traverses the gland, branching into the posterior auricular, maxillary, and superficial temporal artery. Additionally, the retromandibular vein that forms within the gland by union of superficial temporal and maxillary veins, contributing to venous drainage. These structures are essential for facial movement, blood supply, and circulation. Now, talking about the blood supply of parotid gland, a parotid gland receives its blood supply from the external carotid artery and its branches, which arise within the gland. Venous drainage occurs through the external and internal jugular veins. Its nerve supply comes from the glossopharyngeal nerve. Now, talking about the nerve supply in detail, preganglionic fibers originate in the inferior salivary nucleus, which then travel via the tympanic branch, form the tympanic plexus, and continue through the lesser petrosal nerve to synapse at the otic ganglion. The postganglionic fibers then reach the gland via the auriculotemporal nerve, regulating its secretion. Now let's talk about the clinical consideration of the parotid gland, or Sjogren's syndrome. It is an autoimmune disorder primarily affecting the salivary and lacrimal glands, leading to chronic inflammation. Now let's talk about the parotid involvement. It causes bilateral, non-tender parotid gland enlargement due to lymphocytic infiltration and gland destruction. Moving ahead, mumps, which is also called as epidemic parotitis. It is a viral infection which is called by paramyxovirus, which causes acute painful swelling of the parotid gland. The pathophysiology includes the virus infects the epithelial cells of the parotid gland, which causes swelling, pain, and fever. Along with the autoimmune and viral conditions, the parotid gland is also affected by tumors and inflammatory disorders. Parotid tumors can be benign or malignant, with pleomorphic adenoma being the most common benign tumor, and mucoepidermoid carcinoma the most common malignant type. Genetic mutations cause uncontrolled proliferation of glandular or ductal epithelial cells. Benign tumors grow slowly and remain well encapsulated, while the malignant tumors invade uh, surrounding tissues and may metastasize. Silidinitis, or the inflammation of the parotid glands, occurs due to bacterial or viral infections. Reduced salivary flow leads to bacteria overgrowth, which causes swelling, pain, and in severe cases also pus formation. Chronic silidinitis results in fibrosis and acinar atrophy, reducing saliva production. Now let's move to our next major salivary gland, which is submandibular gland. It is the second largest salivary gland. It is a mixed type of gland, that is, it has both serous and mucous units, but the serous units dominates. Talking about its location, the superficial part of the gland fills the digastric triangle. Deep part lies deep to the mylohyoid and the superficial to hyoglossus and styloglossus. The gland is J-shaped and it weighs around 10 to 20 grams. The duct of the submandibular gland is known as the Watten's duct. It is 5 centimeter long and it is thin walled. Now let's talk about the Blood supply of the submandibular gland. The submandibular gland receives arterial supply from the sublingual and submental arteries and venous drainage via the common facial and lingual veins. It is innervated by submandibular ganglion carrying secretomotor, sensory, and vasomotor fibers. Sympathetic activation Sympathetic activation reduces blood flow, decreasing saliva production while increasing enzyme-rich serous secretions. Moving ahead, let's see the clinical consideration. Silolithiasis, the salivary gland stones. The formation of salivary stones obstruct the submandibular duct, which is the Wharton's duct, which leads to swelling and pain. Similar to parotid gland, silodenitis, the submandibular gland inflammation. It is the infection or inflammation of the submandibular gland, commonly due to bacterial infection, which is Staphylococcus aureus or Streptococcus species. The Kuttner's tumor, the chronic sclerosing silodenitis. It is a chronic inflammatory disease of the submandibular gland leading to progressive fibrosis and gland enlargement. And the Sjogren's syndrome, it is an autoimmune disorder, as we already saw. It causes chronic inflammation and destruction of the salivary and lacrimal glands. Moving ahead to our final major salivary gland, which is the sublingual gland. It is the smallest of the major salivary glands. It is located between the floor of the mouth and the mylohyoid muscle. It is a mixed gland with mucus unit predominating. It drains via the sublingual duct and multiple ducts of Rivenus. The blood supply comes from the sublingual and submental arteries. The parasympathetic innervation is via the facial nerve, through the lingual nerve, and the submandibular ganglion, while sympathetic fibers arise from the plexus on the facial artery. Yes, now talking about the histology of all the major salivary glands. The parotid gland is purely serous, so it contains acini lined by pyramidal cells with abundant zymogen granules. The submandibular gland is a mixed gland with serous acini predominating and a few mucous acini capped by serous demilunes. The sublingual gland is also mixed, but mucous acini dominate with scattered serous demilunes. Sorry. All three glands have a ductal system, including intercalated, striated, and excretory ducts, which modify saliva composition. The structural differences in these glands reflect their distinct roles in digestion and lubrication. Moving ahead to the thyroid gland. So, the thyroid gland is the largest endocrine gland. The location is the gland lies against C5 to C7 and T1, embracing the upper part of the trachea. Each lobe extends from the middle of thyroid cartilage to fifth or fourth tracheal ring. You can see all of this in the diagram besides. Isthmus, again, isthmus extends from the second to fourth tracheal ring. It consists of two lobes, right and left lobe. It is joined by isthmus. The weight of the gland is 25 gram, and there are two capsules of thyroid gland, which is true and false capsules. So, yeah, talking about the blood supply of thyroid glands, the arterial supply of the arterial supply consists of superior thyroid artery, inferior thyroid artery, as well as the accessory thyroid artery. The venous drainage of the thyroid gland is done by superior thyroid veins, which drains into internal jugular vein. The middle thyroid vein drains into internal jugular vein again. The inferior thyroid vein drains into the left brachiocephalic vein. And the nerve supply, it is derived from middle cervical ganglion and partly from superior and inferior cervical ganglion. Now, talking about the microscopic structure, the thyroid gland consists of follicles lined by cuboidal epithelium filled with colloid storing thyroglobulin. Follicular cells produce T3 and T4, while the parafollicular, the T cells, secrete calcitonin for calcium regulation. It is a rich capillary network which surrounds the gland, ensuring efficient hormone secretion for metabolism and growth control. This is exactly what we discussed. The thyroid gland produces T3 and T4, regulating the metabolism. Then it increases energy production, oxygen consumption, heart rate, and cardiac output while supporting brain and bone development. Calcitonin lowers the blood calcium by inhibiting bone resorption, maintaining calcium balance. Yes. Now, this is again a difference between hyperthyroidism and hypothyroidism, which now I will just brief it with highlighting. I'll brief it by highlighting the main points. So, hyperthyroidism occurs due to excessive T3 and T4 production. It increases metabolic rate. Sorry, causes uh, in the Graves' disease, toxic multinodular goiter, thyroid adenoma, and thyroiditis. The overstimulation of the thyroid leads to symptoms like weight loss, intolerance, tachycardia, and tremors. In Graves' disease, TSI autoantibodies mimic TSH, causing unregulated hormone production. A severe complication, the thyroid storm, which results in extreme hormone elevation, leading to fever, cardiac failure, and hypermetabolism, requiring urgent treatment. Sorry. Now let's go to the hypothyroidism part. Hypothyroidism occurs due to inadequate T3, T4 production. It is due to the slowing metabolism. Causes include Hashimoto's thyroiditis, iodide deficiency, uh, then post-surgical or post-radiation hypothyroidism, congenital hypothyroidism. The pathophysiology includes autoimmune destruction, that is the Hashimoto's, which leads to lymphocytic infiltration, glandular atrophy, and fibrosis, resulting in decreased hormone production. Then the symptoms include fatigue, weight gain, cold intolerance, bradycardia, and myxedema. In infants, congenital hypothyroidism results in stunted growth and intellectual disability, that is the cretinism. Proper diagnosis and treatment with thyroid hormone replacement are essential. It is of great importance. Now let's come to the clinical consideration of thyroid gland. The Hashimoto thyroiditis, the chronic autoimmune disorder causing thyroid destruction and hypothyroidism. The Graves' disease, it leads to hyperthyroidism due to TSH receptor stimulating autoantibodies. Thyroid storm or the thyrotoxic crisis. It is a life-threatening hyperthyroid crisis triggered by stressors. Then the D. quervains thyroiditis is a self-limiting viral-induced inflammation causing painful thyroid swelling. You can here see in the diagram besides the Hashimoto's disease, the normal thyroid, while the enlarged thyroid. Yes. Next, the goiter. Goiter is an abnormal thyroid enlargement due to iodide deficiency, increased TSH, or nodular growth. Diffuse goiter results from chronic TSH stimulation, while multinodular goiter may be toxic or non toxic. Severe cases cause dysphagia and tracheal deviation. Thyroiditis is a thyroid inflammation due to autoimmune, viral, or drug induced causes, leading to transient hyperthyroidism followed by hypothyroidism. Then the Hashimoto's thyroiditis, which is a chronic autoimmune destruction, subacute granulomatous thyroiditis, then postpartum thyroiditis. Then pathophysiology includes in autoimmune thyroiditis, T cells attack thyroid follicular cells, causing inflammation, fibrosis, and hormone deficiency. In subacute thyroiditis, viral infection triggers granulomatous inflammation, leading to pain, fever, and transient thyrotoxicosis. Then the thyroid neoplasms. Thyroid neoplasms result from uncontrolled follicular or parafollicular cell proliferation, Benign tumors include follicular adenoma, while malignant types include papillary, common slow growing, follicular hematogenous spread, medullary calcitonin producing, and anaplastic, which is uh, aggressive and poor prognosis. The pathophysiology includes genetic mutation, which drive uncontrolled cell proliferation, and some tumors remain encapsulated while malignant forms invade surrounding tissues and metastasize. So, to conclude this whole topic, I thought what a better question than to ask if what if the glands were absent from the body? So, several essential physiological processes would be severely affected or cease to function. Glands produce and secrete hormones, enzymes, and other substances necessary for homeostasis, which would completely compromise the usual human behavior, right? Because we read so much about so many things and so many factors. So, in summary, the glands are vital for digestion, metabolism, immunity, reproduction, and overall homeostasis. So, without glands, our survival would be impossible. I thank you all for your patient hearing. I thank you all for giving your time. Thank you so much. This is me signing out.